So the Region 2 Public Health Training Center is housed within Columbia, and essentially we exist to improve workforce development, provide technical assistance, student internships and programs in the public health sector. So we exist to strengthen workforce development and essentially ensure that the public health workforce is strong in this country, and throughout our region. And we also we have New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands as the territories that we oversee within our region. So the training program that we brought to the USVI was called ALTC, Advancing Leadership in Times of Crisis. This was a program that originated in Puerto Rico in 2015, and it was really successful actually in Puerto Rico. And so historically, the U.S. Virgin Islands has been left out of a lot of the funding opportunities and program development within Region 2. We do a lot of great work in New York, New Jersey, and in Puerto Rico, but we wanted to bring this program to the Virgin Islands and have this pilot launch there because it was so successful in Puerto Rico, and we were able to reference that success and bring it to St. Thomas for the first time this year. Within the ALTC program, when we piloted it in St. Thomas, it was an 8-week program. We went through 6 different courses. So some of those courses focused on public health law, adaptive leadership, health communication and advocacy, project management. We wanted to really ensure that we were giving public health leaders the tools that they needed to navigate challenges and crises that might come up. So whether that's environmental emergencies such as hurricanes or pandemics such as COVID-19, how can leaders best respond to these crises and be able to provide the resources that are needed to the communities. We launched in St. Thomas in May of 2025, and we had a total of 6 graduates this first cohort, which might seem small, but for a pilot launch was actually just what we were hoping for. And these 6 people range from different levels of leadership within the USVI Department of Health. So some of them had clinical backgrounds. We had a nurse practitioner. We had some people that were in community health work, individuals coming from just various divisions within the health department. This program is really critical, and it's important because it helps strengthen the workforce development of public health leaders in the Virgin Islands, which is essential, and it's essential throughout the regions that we oversee, but we want to give leaders the tools they need to adequately respond to these crises. Just as times are changing and we have different technological advancements, we want to ensure that our public health leaders are prepared and are ready to respond to some of these challenges that are definitely going to arise in the future. This grant is essential because it allows us to strengthen the public health workforce, and I think when you have a strong public health workforce, you ultimately create healthier communities, happier communities, and we can do that by ensuring that staff and public health leaders have the tools to ensure that they can show up to work and do their best on a daily because they've been trained and they have professional development opportunities and can stay up to date with the changing ecosystem of public health.